We're going to be going over some of the parts of the heart today. Let's start with the basics. First off, this is the base of the heart, and this is the apex. This is the anterior side, and this is the posterior side. The four great vessels are the pulmonary trunk, the aorta, and the superior vena cava, followed by the inferior vena cava. You also have the right auricle and the left auricle, sort of like flaps of tissue that you can see elsewhere. Inside, we have the right atrium and the left atrium, the right ventricle and the left ventricle. The atrium can be remembered through the fact that Romans had atriums as well, as do a lot of expensive houses these days. You also can see the bicuspid or mitral valve and the tricuspid valve. If you look up here, you'll see the pulmonary semilunar valve and the aortic semilunar valve. The aortic semilunar valve goes up here with the aorta, and as you can tell, the pulmonary valve goes right here with the pulmonary trunk. Pulmonary semilunar valve. Now on to something a little more difficult. The left coronary artery starts at the base of the aorta. You can't see it here. It goes underneath the pulmonary trunk, underneath the left auricle, and divides into two. You can see the first branch down here in the anterior interventricular artery, and the second branch over here with the circumflex artery. You can see it just underneath that blue line. Now, an easy way to remember the anterior interventricular artery is to note that it goes down the anterior interventricular sulcus. Both of those, in turn, are over the interventricular septum. What's in the middle of the interventricular septum? Myocardium. The interior surface of the heart is endocardium. Exterior surface of the heart is epicardium. Next, we go to the right coronary artery, which you can see goes down underneath the right auricle. The right coronary artery feeds into the posterior interventricular artery and the right marginal artery. If it's going to be on the right and it's going to be red, it's going to be a right marginal artery. Next, we have the coronary sinus, this big blue field in the back. The coronary sinus is fed by the great cardiac vein. It goes along the front. Doesn't have the word interventricular in it, but still goes along the interventricular sulcus, and it feeds back here. The middle cardiac vein you can see just here. It's along the back. And the small cardiac vein you can see on the right hand side of the heart, just under the right marginal artery. Hope this helps. Best of luck.